Continuing debate, the Honourable Member for Guelph.
Thank you, Mr. Speaker. And Mr. Speaker, I first want to thank the member from Cariboo Prince George for bringing this very important issue before the House, an issue that's silently affecting many Canadians every day. Post-traumatic stress disorder is a matter close to the hearts of many, even in this House, as the member has said. Some members have honorably served on the front lines of emergencies. Some have families and loved ones whose lives have been touched by those working tirelessly to protect us. In fact, Mr. Speaker, my grandfather immigrated from England, serving the Royal Engineers in World War I, and spent many months in the Brandon Sanatorium being treated during a time when there was very little known about these disorders. The government stands proudly behind our country's police officers, paramedics, and firefighters. We stand behind Indigenous emergency managers, correctional officers, 911 dispatchers, and border guards. We stand, of course, behind the members of our armed forces. And we stand behind all the brave women and men who have pursued the noble path of public service and who put their safety and well-being at risk for the sake of their communities and of their country. In our platform, we committed to developing a national action plan on post-traumatic stress disorder, and the Prime Minister's mandate letter to the Minister of Public Safety and Emergency Preparedness instructs him to work with the provinces and territories and the Minister of Health to develop a coordinated action plan on post-traumatic stress disorder, which disproportionately affects public safety officers. Indeed, the research shows that between 10 and 35% of first responders will develop post-traumatic stress injuries in their lifetime. An estimated 70,000 Canadian first responders have already been diagnosed. That's why I'm proud to say that our government is hard at work developing the action plan to address post-traumatic stress disorder among public safety officers that we promised during our campaign. Immediately after our government took office, Public Safety Canada launched an extensive consultation process, beginning with sessions in Ottawa and Regina, to hear from stakeholders about PTSD and other operational stress injuries, and about what kinds of supports they needed. As part of these consultations, we heard directly from public safety officers, as well as from healthcare practitioners and all levels of government. We heard about barriers people face when seeking assistance. We heard about cases of limited access to treatment options, the challenges of geographic isolation, and a general lack of awareness regarding operational stress injuries and PTSD, including a lack of awareness about the symptoms and about available supports. And we agree that the many voices have told us that much more needs to be done. In particular, we heard about the need to address three key themes: research and data collection, prevention, early intervention, and stigma reduction, and the support for care and treatment. And the stakeholders, the stakeholders' voices have recently been bolstered by a report on the Standing Committee, as was mentioned, the Committee on Public Safety and National Security. Mr. Speaker, that committee also heard from a wide range of organizations and individuals, including the Canadian Police Association, Mood Disorders Society of Canada, and many experts on psychiatry and mental health. At this point, I want to mention that Mood Disorders Canada is in my riding of Guelph. In fact, Phil Upshall, the Society's executive director, has made it clear to me that our nation needs to do more to assist those who suffer from this condition, especially when so many are affected by it and as a result of their nation's service and our first responders. Another unique Guelph organization that's leading the nation in treating PTSD is the Homewood Health Centre. Homewood has developed the program for traumatic stress recovery, one of the few inpatient programs of its kind in Canada. The program for traumatic stress recovery helps patients recover from the after effects of trauma and creates a community that helps trauma patients through the healing process. Mr. Speaker, I think we have to look at those Canadians that have helped us in so many ways to provide safety for our communities, and in process of so doing have stood in the way of danger themselves. The committee has also received briefs on the Badge of Life of Canada, the Royal Ottawa Health Centre Group, and the Union of Canadian Correctional Officers, among many others. Their final report affirms that the well-being of those who serve our communities is absolutely vital to the safety of all Canadians. And the report makes 16 recommendations. As the Minister of Public Safety wrote in the government's response, the committee's report presents important considerations to inform the government's approach to supporting those who have dedicated their lives to protecting our communities. The report will be a valuable resource as the government moves forward with its commitment to supporting the well-being and resilience of Canada's public safety officers. Mr. Speaker, through all this momentum and action, a clear consensus has emerged. National leadership and coordination are needed to address this issue effectively. Resilience and reintegration and the need for coordinated national research have all been identified as important themes. And there remains a broad view that a national plan must recognize that effective support demands coordinated national baseline research. An action plan must recognize the importance of collaboration in providing access to prevention, education, and training measures, as well as to innovative care and effective treatment. And finally, we've heard loud and clear that we must promote awareness for public safety officers and their families of both the symptoms to watch for and the treatment resources that are available to them. Mr. Speaker, strengthened by all of these voices over the last year, we're moving this action plan forward, helping to bring post-traumatic stress disorder and operational stress injuries out of the shadows and into the light. I'm pleased that our discussions in this chamber make that light even brighter. Indeed, over the course of the last year, members have had more opportunity than ever before to bring this issue to the forefront. We're making sure that we're talking to the right people, moving forward in a way that reflects the voices that we've heard, and working closely with all partners as this plan develops. We've reflected this priority every way we can, including through the budget process, with Budget 2016 reflecting the government's commitment to an action plan. But this goes beyond commitment, Mr. Speaker. It's a responsibility of the government and of all of us who represent our communities that rely on the tireless and selfless contributions of the brave women and men who keep us safe. And to those men and women, we say thank you. And thank you, Mr. Speaker.